So today we're going to be talking about the problem with modern medicine. And if you don't know me, my name is Dr. Christian Poulos. I am a doctor who quit medicine in the pursuit of owning my own business. And currently I am a health and longevity coach and working on a few other things on the side. I will tell you when they're launched because I don't like to spoil secrets. So anyway, let's start this out with a story because I'm becoming quite the storyteller these days. So picture this. You are a doctor in 1846 Vienna, and you've just made an amazing discovery that could save thousands of lives. The solution? Simply washing your hands. Plot twist, your fellow doctors think you're completely crazy and end up sending you to a mental asylum. Talk about not getting a round of applause for your breakthrough. So this isn't the plot of a dark comedy. It is actually a true story of Ignaz Semmelweis, a Hungarian doctor who discovered that hand washing could prevent deadly infections in new mothers. So back then, doctors would go straight from cutting up dead bodies to delivering babies without washing their hands. If you are cringing right now, congratulations, you have more medical knowledge than a physician in the 19th century. So this story gets even more interesting when you actually look at those details. So in Semmelweis' hospital, there were two maternity wards. One was staffed by doctors and medical students. The other one was by midwives. And the wild part is that the midwives ward had 5 times fewer deaths from childbed fever than the doctor's ward. That's right. So the less qualified caregivers were getting better results than the highly trained physicians. It's kind of like finding out that the amateur chefs are serving safer food than professional restaurants. It's just weird. So Semmelweis was determined to solve this mystery. First, he thought maybe it was because women in the midwives ward gave birth on their sides instead of their backs. Nope. Then he wondered if it was because a priest walking through the ward ringing a bell was scaring women to death. Literally. Wrong again. So finally, after a colleague died from cutting himself during an autopsy, Semmelweis had this aha moment. It wasn't bad luck or scary priests. It was invisible particles, which we now know to be bacteria. Those are being transferred from dead bodies to the living patients. But here's the real kicker. It took until 1998. Yep, you heard that right, 1998, for hand washing to become a standard requirement for doctors between patients. That's literally 150 years after Semmelweis first suggested it. If medical progress were a turtle, this turtle would have been taking a very, very long nap, possibly in a coma. So the evolution of medical knowledge in the 1800s has come a very far way. So doctors believed diseases were caused by bad smells and miasmas, which is basically stinky air. So back then their solution was just letting leeches suck out of your bad blood. If this sounds like medieval nonsense to you, remember that some of today's common medical practices might look just as ridiculous to people 200 years from now. So it's like, you mean they're used to cut people open to fix things? How barbaric. It's kind of one of those things. So the way doctors thought about disease back then tells us a lot about why they resisted Semmelweis' ideas. So imagine someone today telling you that your smartphone works by tiny elves running around inside it. You'd probably be a little skeptical too. So the difference is that Semmelweis had actual evidence that hand washing saved lives, but the doctors couldn't see past their own beliefs or their own egos. So today's medical system faces a lot of similar challenges, but it is for different reasons. Doctors now make an average of around $270,000 per year, mostly from treating sick people. While they're excellent at handling emergencies and acute problems, like if you crash your bike or your motorcycle and need surgery, they're not really set up to keep people healthy in the first place. It's kind of like having a really expensive fire department, but no fire prevention program, or a very skilled umbrella salesperson who only shows up after you're already soaking wet. So the way doctors get paid creates what economists call perverse incentives, which are situations where the reward system encourages exactly the opposite of what we actually want. We want people to stay healthy, but the system makes more money when people are sick. It's like paying a personal trainer based on how many times you fall off the treadmill or rewarding a teacher for how many students fail their class. It's kind of weird to think about, but that is our modern medical system. And this problem actually goes a lot deeper than the individual doctors. I truly don't think they are the problem. It really is the entire healthcare system, including insurance companies and hospitals. They operate on what's called an ascension model. So you start with small, cheap treatments, but as problems get worse, you move up and up to more expensive solutions. It's kind of like a video game where each level costs more to play, except this game involves your health and your wallet, which is not a fun game to play. So we have a big prevention problem as well. So Dr. Sarah Josephine Baker, one of America's first female doctors, faced this issue head on in the early 1900s New York. So she focused on preventing diseases in children through basic hygiene, education, and Hell's Kitchen, one of the city's poorest districts. So at the time, around 1,500 babies were dying every week in the summer just from diarrhea. Yes, people die from diarrhea. And that's more deaths than most modern cities see in a year. So Baker's solution was sending nurses to visit new mothers and teach them basic things like washing hands, breastfeeding, and just simply getting some fresh air into their homes. She also set up some baby health stations to distribute clean milk instead of the beer, yes, beer, or dirty water that many of these mothers were giving to their children. So the result was that she saved around 90,000 children's lives and reduced infant deaths by around 40%. The response from other doctors? They tried to get her fired because she was cutting into their business of treating sick babies. Talk about awkward office politics. How dare you try to keep these babies healthy? How are we going to make a profit? Anyway, the mayor looked at these numbers and told these doctors to back off. And by the time Baker left her job, all 48 states had copied her child health programs. So today's medical system still struggles with prevention, as I'm sure many of you have realized. So we're the most medically advanced society in history, yet we're also dealing with record levels of obesity, chronic diseases, and health problems that could often be prevented. We can transplant hearts, we can transplant hair and sequence genomes, but we can't seem to convince people to eat their vegetables or get enough sleep. So consider this. The average child gets sick about 4 times a year. That's considered normal. But is it really? Some families who focus on prevention and basic health practices report that their children rarely get sick, even when traveling around the world. Some parents argue their kids never get sick, despite having been to several countries. It's almost as if our bodies were designed to be healthy, and getting sick isn't actually a required childhood activity, like losing teeth or being embarrassed by your parents. So anyway, remember that Semmelweis and his crazy hand-washing idea? Modern medicine still often resists new approaches, especially if they're very simple or challenge the status quo. Take nasal hygiene, for example. Every day, we breathe in about 11,000 liters of air, which is enough to fill half a tanker truck. Yet while we happily brush our teeth and wash our hands, most of us never clean the organ responsible for filtering all the air that we breathe. Our noses are actually amazing air cleaning machines. They're equipped with mucus that traps bacteria and viruses, and the mucus is even slightly acidic to help kill those invaders. But modern life, with its good old air conditioning, caffeine, and dry air, can mess up this natural defense system. It's like having a sophisticated security system, but leaving it unplugged most of the time. Research shows that simple solutions like saline nasal sprays with xylitol can help prevent respiratory infections. You don't really hear this because it's not very profitable to tell people to spray salt water up their nose. Medical companies can't patent salt water, so they're about as interested in promoting it as a cat is in promoting dog toys. The resistance to simple solution goes beyond just nasal sprays. Ear infection, sinus problems, or congestion strikes, doctors often prescribe nasal decongestants or nasal steroids. These medications actually work by suppressing your immune system, the exact opposite of what your body is trying to do. It's like responding to a fire alarm by removing the batteries instead of checking for a fire in your house. Perhaps the most striking example of our resistance to simple solutions is actually how we treat food and exercise. So despite mountains of evidence showing that proper nutrition and regular movement can prevent or even reverse many chronic conditions, our medical system still reaches for the prescription pad first. Like having a car that's running badly because you've been filling it with soda instead of gasoline, but instead of switching to proper fuel, you keep adding more and more engine additives to mask the problems. Doctors that receive virtually no training in nutrition, I literally had like 2 classes in nutrition and I probably skipped one of them, and suggesting lifestyle modifications often feels like an afterthought rather than a first-line treatment. And truthfully, a lot of patients don't want to do it in the first place. So meanwhile, exercise is treated more like a hobby than medicine, despite being more effective than many drugs for conditions like depression, diabetes, and also heart disease. It's like we've built a healthcare system that ignores the 2 most powerful medicines available, what we eat and how we move, in favor of more complicated and expensive solutions. So imagine going to a car mechanic who never checks your oil or your tire pressure, but is very skilled at replacing expensive parts once they break down. That's kind of our current approach to health. It is crazy, it is messed up, it needs a lot of change. So in the 1800s, a doctor's reputation was literally everything. If you were the head of the hospital, no one was supposed to be smarter than you. This led to situations where being right was less important than being the right person to be right. It would be like refusing to believe in gravity because your rival was the only one who pointed out that things fall down. Now, there is someone else calling the shots as the head of the hospital, which are hospital administrators. So imagine a restaurant. I'm a big guy of analogies. I will probably annoy you with these, but imagine a restaurant where neither the head chef or none of the cooks make decisions about the kitchen. Instead, all the important decisions from ingredients to cooking times are made by someone who's never cooked a meal but has an MBA in restaurant efficiency. That is literally what is happening in most hospitals. Administrators with business degrees but zero medical training are making crucial decisions about patient care, staffing, and medical procedures. They're like football coaches who've never played the game, telling professional athletes exactly how to throw the ball. These administrators often prioritize profits over patients, viewing healthcare through spreadsheets rather than stethoscopes. They implement policies that could look good on paper, but make about as much sense in practice as requiring surgeons to operate with only their non-dominant hand to save money on surgical gloves. So the result is that doctors and nurses find themselves following rules created by people who wouldn't know a pancreas from a pacemaker, all while trying to provide the best care possible with increasingly rigid constraints. So modern medicine has become increasingly complex. There are layers of insurance companies, regulations, and specialized departments. While some of this complexity is necessary, I do think it creates a system that's about as easy to navigate as a maze designed by a mischievous squirrel who's had too much coffee. This complexity makes it difficult for doctors to spend quality time with patients or trying new approaches, and many doctors report spending more time filling out paperwork than talking to their patients. Imagine your car mechanic. I have the car mechanic analogy. They spent more time filing insurance claims about your car than actually fixing it. Or if your hairstylist had to do 30 minutes of paperwork before giving you a 10-minute trim. It's all insanity. Medical bills have become the number one cause of bankruptcy in the United States. And here's the scary part. Most of these bankruptcies happen because they happen to people who have insurance. It's like having car insurance, but you're still going broke because your car keeps breaking down. And the problem really isn't the lack of insurance. It's the lack of health. So the solution, the fix for modern medicine isn't about throwing out everything we have. After all, if you are in a serious accident, you definitely want modern emergency medicine on your side, not someone suggesting you try meditation or essential oils. Instead, we need a system that balances treatment with prevention, that rewards keeping people healthy as much as treating them when they're sick. We need doctors who aren't afraid to recommend simple solutions, even if they're not profitable. We need a medical system that puts people health first, not their wallet. And maybe, just maybe, we need to be willing to wash our hands and your noses when someone suggests it's a good idea, even if it takes less than 150 years to catch on this time. So the good news is that change is possible. Just ask the ghosts of Semmelweis and Dr. Baker. Their once radical ideas are now common sense. So today, doctors who don't wash their hands between patients aren't just considered wrong, they're considered dangerous and probably going to be fired. Maybe in another 100 years, we'll look back to today's resistance to prevention and simple solutions the same way we now look at doctors who refuse to wash their hands. Until then, maybe you should keep some hand sanitizer handy, consider cleaning your nose, and remember that sometimes the best medical innovations are the simple ones. Just eat healthy, eat real food, exercise, and go get some rest. So that was a very ranty video. Hopefully it all makes sense to you. Feel free to comment any questions below, and I will catch you in the next video. Hope you like this a little bit more off the cuff, office style video.